Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart, Life as a Dad, and a 35-year cancer survivor, available on Amazon. If this video seems familiar, like deja vu, that you got to see my last video on this topic, it seems that the powers that be decided to pull my video for whatever reason. There's been no explanation given. I have reviewed it over and over and over again. I can't find one thing that they had a problem with. So I've decided I'm going to try and re-record it, and I'm going to try and change as much as I can. And if I seem like I'm reading, I am. I have notes that I took to make sure that I still cover all those very important topics that I was covering in that video. And of course, I'm talking about cancer survivorship and building your care team. And one of the final and most important members of that care team is going to be a cardiologist, or, since we're dealing with the world of cancer, cardio-oncology. And the difference between those two is that a cardio-oncologist is more aware, and I'm thinking this might be one of the dangers. The cardio-oncologist deals specifically with the risks of late-term side effects from cancer treatments. So it's important that when you get released from your oncologist after 5 years, that you continue seeing your primary care doctor and or a cardiologist, cardio-oncologist. Okay, some simple follow-up tests. Again, I stress I'm not a doctor. I'm going through by recommendations from the Children's Oncology Group and Cleveland Clinic, as well as my own personal experience. Simple EKGs and echocardiograms every 2, 3, 4 years. They either tell you everything's fine, or they tell you, hey, we need to watch you a little more closely. So some of the things that you have to watch depends on if you're dealing with radiation related issues or chemotherapy related issues. First I'll deal with is the long-term radiation issues. These are things that we don't really think about, because once you're done, you think, you move on. But effects from radiation damage is called radiation-induced heart disease. Okay, and for me, that popped up 18 years after I was done. Now, it didn't just pop up, it's just that's when it got noticed. It was actually developing over a number of years. Some of the issues, in particular, like in my case, was accelerated coronary artery disease. I was also developing valve damage and eventually heart failure. So depending on where you're, how you were treated, whether, like in my case, it was upper mantle, so this whole quadrant of my body. Breast cancer also puts you at that kind of risk. Let's see, and here's where I go. I'm trying to make sure I got my notes. They can lead to serious conditions, and they need to be caught earlier. Okay, and the fact that I disappeared from my oncologist after 5 years, and really, I never saw my primary care doctor except once a year for a seasonal allergy shot. So there was no follow-ups until I made a phone call and said, hey, doc, I'm tired of feeling this way. And 36 hours later, I was on a table having emergency open heart bypass surgery. You want to get to that stuff before, and the only way you're going to do that is if you're being followed up. Now, it's not to say that you're going to develop these issues or not. But since you have no way of knowing if you are without being followed up on, it's better to stay on top of it. So let's see, we're going to switch over to chemotherapy. Okay. So, and again, I think I'm wondering if this is one of the words that might have given me problems. So it's poison. Okay. So, again, these side effects can develop immediately as you're going through the treatments. They can develop years, decades later. We often, because when it comes to certain chemotherapeutic drugs, mainly anthracyclines, like adriamycin, doxorubicin, we in the cancer world call that the red devil, because it's one of those things where it exists and it's bad, but it cures. but it can also cause chronic heart failure, cardiomyopathy, which is a weakened heart muscle, coronary artery disease, arrhythmias, valve damage, things like that. The thing is, when you're going through chemotherapy, a simple test, a 2D ultrasound, can pick up if you're actually developing any damage as early as the first treatment. So it's up to a patient to advocate for themselves. Hey, doc, is there a chance to do this after the first treatment? Or especially if you're feeling symptomatic, it's important that you let your doctor know that you're symptomatic and then get that 2D ultrasound done. Why? Because if damage is developing, they can stop the treatment. They can adjust the treatment. They can go to a different treatment. But if you're developing damage from treatment number 1 and you go through all 12 or whatever it is, you're creating irreversible damage. And that's problematic. So a simple 2D ultrasound can determine this, and it's crucial. There's really no rhyme or reason. I know at the point when I was going through that chemo, I was 160 pounds. I know people that were 100 pounds, and some people it affects, some people it doesn't. It's also depending on dose dependency. So I've mentioned all the other things that can go wrong with it. The final thing about these treatments that we go through, that, Cleveland Clinic pointed this out, that there is a noted accelerated aging to our bodies internally. Doctors have learned this when they go inside and have to do surgeries and stuff like that, that internally these treatments age our bodies. So while I look like a normal, healthy 60-year-old, inside I can be anywhere between 70 and 80 years old inside from all that stuff that was done to me. So let's see. Things that you want to watch out for. Make sure you're monitoring for symptoms, shortness of breath, especially when you're laying flat, fatigue, swelling in your legs or abdomen, and heart palpitations. Okay. Other than that, make sure you follow up with your primary care doctor, and if you have a cardiologist or a cardio-oncologist, it's not a bad thing. They're not there to watch to see if your cancer came back or anything like that. You have all these team members that I've been pointing out in these videos. In the event that something does start developing early, they can get on it. Now, to give you an idea, okay, this is what I've learned about my heart over the years since 2008. My left anterior descending artery needed to be fixed. My right coronary artery needed to be fixed. These are both the two main arteries to the heart. I've had to have my aortic valve replaced. I have my mitral valve under watch, eventually going to need to be replaced. I have something called reverse septal wall motion. I have a murmur. I have something called a left bundle branch block, which affects the electronics of my heart. And of course, several years ago, I was labeled as being in congestive heart failure. And as of my last appointment, which was 6 months ago, I was diagnosed with myocardial ischemia, which you'll have to look all these things up. I can't go into the details in under 10 minutes. But basically, the lower part of my heart is not filling up with blood completely. Not a good thing. And yes, I do have symptoms, which my cardiologist is aware of. So if you're curious about my other video, you can go to see it at YouTube, at my channel, at Paul's Heart. If not, I've got my fingers crossed that this video is going to meet the powers that be and what they don't want to hear and will allow to be heard. Until next time, this is Paul's Heart.